I have a question regarding the Hasidic community, and I don't know if you have any ties with Canada, but I know I'm close to Montreal, and there are ties there. And in Montreal, like in the rest of Canada, maybe with some exception in New Brunswick, but I'm not even sure it is holding now. Uh, there is a complete ban on hydroxychloroquine. The government, the federal government, the provinces have been extremely proactive in banning that type of medicine, and there is no movement. In the US, you have at least a number of doctors treating people. In France, also, you have a big debate in France. In Canada, I can promise you, there is a handful of people who basically take early treatment seriously, and still Montreal was not that far from New York in terms of mortality. It was the epicenter of Canada. So I was wondering if you heard about how people in your community in Montreal were dealing with the disease, and maybe you have a message to the Canadian authorities, because this is not going away. There will be infections, maybe not a big wave, but there will be continued infections for a while, and people need treatment.
So yes, I do have connections with Montreal. Many of my patients have family in Montreal, and so I did get a lot of people reaching out to me. And I'll tell you a really tragic case. There was a young woman in her late 20s who was 6 months pregnant, diagnosed with COVID. She reached out to me because her family are my patients, and she lived in Montreal. And she asked me what I recommend, and I said I definitely recommend that she starts treatment because pregnancy, second and third trimester, is a high risk. And she said thank you, and she called her doctor, and they refused to give it to her. 6 days later, she had pulmonary infarcts and bilateral strokes. She lost her baby, and she is still on a ventilator, and we're talking about 2 months later. That's what I'm familiar with, and this is, you can scale that by hundreds, if not thousands of cases that I've heard, because what happened is, initially, I was really the only vocal, really the only vocal force giving hope and kind of a treatment option, besides go home and wait until you need a respirator. And so the entire world started calling me. I remember one day I had over 10,000 texts. I developed calluses on my fingers from texting so much. And it just became unbelievable. So my focus, I realized, needed to be on educating providers in different communities in different parts of the world, so that they could then treat their own communities. Because how could one person manage? So that's what I did. I started trying to physicians, hospital systems, anyone who would listen. And the word did get out, and thank God. And so the burden on me personally got reduced. So my message to not only to Canada, but to any government, any person in power, is even if you have selfish motives and you want to preserve your own positions of power, what I strongly recommend is that you look out for the best interests of your people, of your constituency, because they rely on you for policy and give access to life-saving medication. You have the logistical capability to provide for humanity, for your people, the right medication at the right time. So you have a decision to make, and I'm talking to all the politicians in the world. You want to be part of the solution or part of the problem? Because if you're part of the solution, you'll be viewed historically as good people who helped end the pandemic and help relieve misery and preserve the sanctity of life. On the other hand, if you choose to be motivated by politics or big pharma influence, or your own arrogance, then I believe, rightfully so, history will view you as mass murderers and guilty of crimes against humanity. Because now you know, it's no longer a secret, that if you use early intervention in high-risk patients using zinc, hydroxychloroquine, azithromycin, or any other antibiotic like doxycycline, you can reduce hospitalization by 84%, and most likely reduce death by, a factor of 5, if not more. So you have to ask yourself this question: how do you want history to view you? How do you want God to view you? I mean, that's what I would answer.
I'm trying, like you, to understand, but what you mentioned, that people in power know, I think, unfortunately, it's not necessarily correct, in the sense that they are advised by people who are telling them, oh, there is no randomized controlled trial, it's unproven, etc. That happens in some countries, like Canada. It's an amazing example where you cannot have access to treatment whatsoever. And but of course, other countries have taken a completely different route, and you know that the mortality rates are much lower in those countries. And then some countries are acting a bit late, like Brazil, but it's amazing what is going on. You have thousands and thousands of doctors who have mobilized with protocols similar as yours. So there is still this huge issue of information, I think, to the political sphere, because I think they are totally disinformed by the bureaucracy. I think that's what is going on in Canada. And I was wondering, you see, if you can extend an invitation to Justin Trudeau to visit your practice, for example, and then you can spend a day with him explaining how you receive patients, how you diagnose them, how you treat them. I think it would make a world of change, because these people are, I think, disinformed by the bureaucracy. It's as bad as that, and the media is playing a role that is basically reinforcing that disinformation about the only approach there, that we need that randomized trial. But anyway, I'm interviewing you. I'd like to talk about the social media, if you don't mind, but maybe on a different angle. These are big corporations. They have many employees. Many of their employees are going to get COVID. This has huge implications. Like for any corporations, you see all this question of corporate responsibility, how to deal with a disease that, if not treated early, can have devastating implications for the functioning of these corporations. Do you think there is a way to send a message to big corporations about that it's in their self-interest for the employees to get early treatment?
I mean, sure. I mean, if it's a corporation that understands that the human resource is really the most valuable resource of any business, then you want to protect that resource as much as possible and prevent, days off from being sick and so on. So even from a completely self-motivated profit perspective, it would make sense to intervene early so that your workforce stays healthy and you maximize your productivity. I mean, that's just common sense.